too.
Welcome back, everyone. It is something that affects 4 out of every 5 pets. Dental disease is the most untreated ailment in pets. Medical Director of Pet Wellness Clinics, Dr. Kerry Peterson, along with District Manager Megan Waldron, joining us now to talk about the signs of dental disease and also what you can do at home to keep your pet's mouth nice and healthy. Ladies, thanks for being excuse me. Thanks for being here. Maybe I'm allergic to the dog. No, that's not the case. What is the puppy's name?
Bela.
Bela.
Yes, she's a Cavalier King Charles Spaniel.
And does she have good teeth all taken care of?
She needs a dental cleaning very badly.
Okay.
So she's going to be our example today of what
that makes sense.
Needs to be cleaned.
Is there a big prevalence? Is there a big problem with this in the first place?
Actually, about 70 to 80% of dogs and cats over the age of 3 have some degree of periodontal disease. So it's really prevalent.
Yeah, when I was a kid, there was absolutely nothing to do with this. You just noticed that your dog's or cat's teeth were just bad, and you just went, I guess that's just a natural thing.
Right. It's not natural. It's a natural occurrence in that they form tartar and plaque, but we can prevent that with dental cleanings and at-home care for our patients and our pets.
What are some of the signs to look for?
Horrible breath. I mean, if your dog knocks you out, that is not normal. We don't want that. We want you to be able to kiss your dog and have those interactions.
Not fall down.
Not fall down. Tartar, if you can see black tartar along the gum line, bleeding gums. Sometimes you'll notice that they're not eating as well as they were. They're dropping food. Those are all signs. Facial swelling, too. You can sometimes see that with dental disease.
What about change in weight and appetite and stuff like that?
Yeah, absolutely. So they can lose weight rapidly if they've got something going on in their mouth because they don't want to eat.
Yeah. What's the importance of taking the dog? I realize you can do some of this at your home, but what's the importance of taking the animal to the veterinarian?
Yeah, so the importance for exams is for the veterinarian to kind of look into the mouth, look around the face, look for any swellings on the muzzle. You know, you can see here a little bit of tartar there. And we want to look for fractured teeth. Fractured teeth are very painful. So
the lines and stuff in them.
Yeah, so we want to make sure that we are on top of that so we can make recommendations. And our dental cleanings are under general anesthesia. We use an ultrasonic scaler, a probe to do a periodontal exam.
And it looks like we have some before and after pictures. Yes. Same animal, but that's amazingly different. And that's after going to the vet?
Yes, that's after scaling and polishing.
Now, can you get anything close to that by doing it at home? Because I know you're supposed to also do stuff at home, too.
Yeah, so once the tartar gets built up so much so that it's kind of like cement on the tooth, they really need to come in for a dental cleaning with an ultrasonic scaler. At that point, once the teeth are clean, then you can do at-home care.
To keep up on it, a little maintenance.
To keep up on it and prevent it from coming back.
All right, let's go ahead and show, because Bailey, I know you're excited about this one.
So,
do most of the animals not get thrilled with this?
They don't, but you can work with them.
Right.
What I recommend is a pet-friendly toothpaste. Don't use your toothpaste. It's got a lot of fluoride in it. It can cause foaming of the mouth, and it can cause GI upset. These are often flavored chicken or beef, so it's kind of like a treat. So give them a little bit of that first so they get used to it. And this is a little pet-friendly toothbrush, so you just want to kind of go along the gum line. You can use the smaller end, too, for cats and dogs. Oh, she doesn't like that. So you just kind of go in there. 1 to 2 times a week will be all that you need. We also have water additives. If your dogs don't like a toothbrush in their mouth, you can use a water additive.
Did you put something on that? Because Bailey looks like it wants actually to have some more.
No, I didn't. I didn't. But the most important thing with dental health is what you can see isn't always what the case is.
Right.
So half the tooth is actually in bone and below the gum line. So.
And if you don't do this, what sort of things can happen?
So dental disease can affect heart muscle. It can affect the liver, the kidneys from that excessive bacteria in the mouth. So it's really important to stay up on this.
You say twice a year probably to go to the vet, maybe?
Yeah, I say exam twice a year, and some dogs need dental cleanings once a year.
Dr. Kerry, thanks for being here.
Thank you so much.
Megan, you as well, and Bela, right? Bela?
Yep, Bela.
Bela, well done. We share the same hair color, so we've got kind of a kinship. Exactly. 2 dogs. Lindy, over to you.
Thank you. It is 6:26, and there is much more ahead in the next half hour. Democrats hit back